Welcome to day 2. I think all of you know me by now. I'm Sunitha Melapati, the Vice President of the CACNA1A Foundation. I almost said VACNA1A. What an extraordinary first day of the conference we had yesterday. Before I go into my talk and really my remarks for this day 2, just going to go over a couple housekeeping items. Our incredible AV team in the back is working hard to get the recordings of yesterday's talk up on the platform by Monday. I received an email last night from Dr. DeBoer that she recorded her hemiplegic migraine presentation for us. So since we were having internet connectivity issues, we're going to get that recording up on the platform as well. For our in-person attendees, we're going to also make sure you all have access to the virtual platform after the conference so that you can access the recordings at your convenience once you get back home. Some of you mentioned to me that you have to duck out a little early today, but before you leave, there are flyers on each of the tables with a link and a QR code to a conference survey. And we're going to remind you of this again at the end of the day, but please, please, please take the time to give us your feedback on what about this conference has worked and what hasn't, besides obviously the internet and maybe the temperature of the room yesterday. We recognize those issues. We'll also be sending out the survey link to our virtual participants, and perhaps Peng Kong or Amy, we could put that in the chat. So we really want to receive your feedback on the virtual experience as well. What else? Okay, so just to acknowledge that there is no way we could have covered the breadth of topics that are important to our families here at this conference in such a short period of time. We want to make sure that the content we covered today or over these 2 days has been valuable, but we also want to hear from our researchers and healthcare professionals in the room. Do you want to see at our next conference? Up on some sleep and start to think about dates and locations. So if you have feedback on those two pieces as well, academic or your clinical schedules, include that, and location ideas, please include that in your survey comments. For those of you in person, the videographer is on site again today, and we would really love it if you could take a few minutes to sit down with them. They are recording brief interviews of our families, and we want to capture those testimonials today. We also would love to capture testimonials from our clinicians and researchers who are here. They've moved to the Senna boardroom, which is to the right of the hotel check-in desk. The videos that we use from this conference will continue to help us raise awareness and fundraise for this important work. So please, please, please try to take a few minutes during the break or lunch. They're going to, I think, be here till 6 o'clock, so stop by there if you can. Okay, with those things out of the way, I'm going to dive right in. I really, truly cannot believe that I'm standing before you today. I never could have imagined. So I asked Amy for tips of how to make this not happen, but here I am, getting emotional already. I really could never have imagined a gathering of this type. The moment I was thrust into the Rare Disease Club over 2 years ago when we received my daughter Sahana's diagnosis. We received the results of her genetic testing in May of 2020 before the CACNA1A Foundation had even launched its website. I was desperate to just find one other family to talk to about this disease because our doctor had offered us not a single piece of practical information after delivering this life-altering news that she has a CAC NA1A variant, a variant that was not listed in any of the genetic databases. Like most of our families, we were told that she is the only one in the world with her specific variant. I've come a long way from that appointment 2 years ago where I repeatedly asked our daughter how to spell the name of the gene. A couple days after that appointment with our geneticist, I had my first conversation with a fellow CACNA1A mom, a former foundation board member, and now a dear friend, Carolyn, who's sitting over there. That conversation changed everything. It was more informative than any conversation we had with our doctor. Carolyn centered me She gave me a practical list of things I could do, people I could speak with to get up to speed on my daughter's diagnosis. I don't know if Carolyn knows this, but that conversation inspired me to transform our despair into what we're doing today. I saw what she was personally doing to organize the community and build the foundation from scratch, along with Lisa Manister, Shanna Tolbert, and Allison Buckner, who's also here with us today. They're the OG moms, that's what I call them. A couple months after that conversation with Carolyn, when I saw the launch of the website that summer, I became involved. I said, sign me up. I'm in. I'll do whatever you want. We aim for the foundation to do what Carolyn did for me that day, to be that welcoming resource, a supportive network for our families, to give them the information they need to feel empowered to go into their doctor's offices and ask the questions they want to know the answers to. Like many families in this room and online, I did not think I would ever feel hopeful again. I learned that there were no specific treatment options or clinical trials available for our community. But I can honestly say, I have never felt more hopeful than I do here today for the futures of our loved ones affected by CACNA1A. We have nearly 150 members of the CACNA1A family, clinical, and research community here in San Antonio and joining us virtually from all over the world. This is the first ever in-person hybrid gathering of our community, and it is a huge deal. We call this the Creating Connections Conference. Finding that connection with others in your community can be life-changing. It's changed mine. The connections we started to create over these 2 days and the sense of community we feel being with others who are traveling similar paths make us stronger, more resilient, and we are learning from one another, empowering each other, and accelerating the path to transformative therapeutics together. This time last year, after our first virtual conference, our board decided to in some way celebrate, to get together, to meet each other for the very first time after a year of working together virtually. We had never met in person. We made a short video to document that meeting. It was one of the most magical days of my life, meeting those moms and their girls for the first time. I know many of you have already seen this video, but I just wanted to take a few minutes to share it today because we wanted to recreate that magic, that day that we all first met. After that meeting, Lisa, Allison, Carolyn, and I, we started planning. We had to make sure other CACNA1A families had the opportunity to feel the same magic we felt that day when we met in Philadelphia. We were very determined to pull off an in-person meeting in the next year. And the results of that are what you're seeing here these 2 days. So Jeff, could you play the video?
We saw so many doctors across the country, geneticists, neurologists, but it wasn't until 2017 when we actually got a diagnosis. Emily was 20 years old.
It was about a year ago we found out that her genetic testing revealed a mutation on her CAC-NA1A gene, or CACNA1A, and it was a relief to find an answer to explain what we were seeing in our daughter, but at the same time it was really, we were shocked and in disbelief because our doctor gave us this news but really had no resources to explain what this meant for her life.
When she was 10, she had a medical crisis and was in the hospital. We now know it was a hemiplegic migraine, which is a stroke-like episode. And so we had to start testing anew just to rule things out, we found her diagnosis.
Individuals with CACNA1A mutations experience a wide range of symptoms, including often uncontrolled epilepsy, a balance and coordination disorder called ataxia, eye movement disorders, and hemiplegic migraines, which are stroke-like events that result in paralysis on one side of the body, loss of skills, and potentially fatal cerebral edema. There are no specific treatment options for this disease, and our kids are often in and out of the hospital to manage medical crises. What is even scarier for us as parents is that CACNA1A can also be neurodegenerative, which is why we need to accelerate research towards a cure.
So we ended up on a private Facebook forum with a lot of other families, looking for information, looking for connections, looking for somebody with our child's exact variant, which we didn't find, but we found commonality with other families, particularly mothers, who were doing the same thing that we were. We were reaching out for connections, we were reaching out for information, and looking to find out what is the best way forward for our child so that she can thrive and have the best quality of life possible.
We set up the foundation in the spring of 2020, right before the COVID-19 pandemic.
So we've met on Zoom, we've met on FaceTime, but we've really never met before. So walking into a room, it was just so different.
I've got to see their faces in little boxes, but I've never had a chance to meet them or their daughters. And so it was really special to be able to see the daughters that are the driving force behind all of our work.
We shared experience, right? I mean, that's what we're all looking for in life, is to find someone who's like shared, I think oftentimes some of our hardest experiences. And there's something really refreshing about being in a room of people who you don't have to explain, and there aren't questions, and you don't ever feel like they're sitting there wondering but not asking their questions. Like, we all just get it.
How can people help the foundation? The bottom line is that we need funding. There is a lot of basic research on the CACNA1A gene, but we are looking to fund translational research, which means research focused on a cure.
The foundation has given us a great sense of hope and purpose, and we know that together we can push science forward. Because the science is there, we just really need to organize our community, we need to organize our researchers, and we need to show them that these kids deserve a cure.
She lights up the room everywhere we go. And it's one of the reasons we wanted to start this foundation, because there's so many kids out there like her, all the other kids with CACNA1A, they have families right behind them, just like we are for Marin, that want them to thrive, want them to succeed, and want them to have the best quality of life. And foundation is going to be the way that we can give it to them.
Thanks to our researchers, we are learning more about CACNA1A-related diseases. But anyone who has been touched by it knows there is still a lot of work to be done. At 24, my daughter's cerebellum has begun to atrophy. The clock is ticking. Our goal as a family-led foundation is to push science forward to discover life-changing treatments for everyone living with this rare disease. Our kids are depending on us.
So we hope you've been already feeling that magic, and you can continue to feel the magic of being able to meet other CACNA1A families that are traveling along this journey with you today. But I want to take a few minutes to step back and share a bit about my personal journey to getting here. My parents, who are both here in this room today and have been by my side before we even knew we were on a rare disease journey, they really wanted me to go into medicine, into the sciences, to help people. After all, it's practically in my genes. They are both retired physicians. Both of my siblings are doctors as well. But I ended up the black sheep of my family. I majored in economics. I went to law school, and I practiced as a corporate attorney. I thought I had ended up as far away from the sciences and medical fields as I could get. Doctors and scientists, you hate your lawyers, right? But after we received my daughter's diagnosis, no one was more surprised than I was. Someone with a faint memory of high school biology, diving headfirst into the latest scientific articles, trying to make sense of the viability of various genetic therapies for CACNA1A, listening to Drug Development 101 talks, learning how other rare disease groups got their communities to clinical trials, and sitting across the Zoom screen with leading clinicians, researchers, industry representatives trying to speak their language. Mom and Dad, I'll admit, some days as I'm furiously looking up the definitions of words I don't understand in a paper I just read, or in a conversation I just had with a researcher, I say to myself, maybe I should have listened to you. Maybe I should have gone to medical school instead. But mostly what I think to myself is that as a rare disease parent or an affected adult, we don't have the luxury of being able to ignore the science. We don't have the luxury of being afraid or intimidated by the science. We don't have the luxury of not trying to understand the science. As one of the moms here said to me yesterday, this is like trying to learn a new language. We have to understand the science, the language of CACNA1A, in order to be effective advocates for our children. We have to understand the language of CACNA1A in order to be active participants in this quest for therapeutics. Problems are solved by pushing for answers. But we as a community cannot push for answers if we don't understand the problem, if we don't speak the language. More than 2 years into this diagnosis, I have learned a lot. But one of the most important things I have learned is that we as rare parents and patients, we have an asset that is critical to the scientific advancement of this disease. That is our lived experiences. Each of us already has a PhD in our child's journey, or if you're affected by CACNA1A yourself, your own journey. We must, as a community, marry that knowledge that families bring to the table with the scientific expertise of our clinicians and researchers. We have to. By bringing all the stakeholders together as a collaborative team centered by families' lived experiences and expertise, we know that we can accelerate progress towards transformative treatment options and ultimately a cure for our community. With that in mind, I acknowledge that today's sessions are very heavy on the science and research. You're going to hear from scientists Dr. Henry Colcraft and Dr. Jen Pan regarding the molecular or functional consequences of CACNA1A variants. And you might not even understand what that means right now. But knowing whether a variant is a loss of function or gain of function can potentially inform the development of therapies. They're both graciously sharing unpublished data with us today. So unfortunately, we won't be recording these talks, but the fact that they're willing to share their unpublished data with us is a testament to their dedication to our efforts. You're going to hear from Dr. Dennis Lal on the development of the CACNA1A variant database that we've been supporting and how we can push our understanding of these disorders forward by aggregating clinical and molecular data. The variant database has the leading up to this creation of the variant database has really started to develop our collaborative network of researchers and clinicians and families. It is through this work that we are going to understand genotype-phenotype correlations, again, the language of CACNA1A. Dr. Al George will be sharing key insights from other ion channels and how those learnings might translate to our calcium channel gene. We're going to hear from Dr. Ethan Perlstein about how all of these activities and the future plans of the foundation will get us from where we are today, which is a world where there are no targeted treatment options for CACNA1A-related disorders, to a world that we are working so hard to create. One where there are life-changing therapies available for everyone living with a CACNA1A variant. We know from being members of this community and seeing the children and adults that are affected that there are many similarities between our experiences. And yet, there are vast differences in how our loved ones with CACNA1A are impacted. We have worked tirelessly to make sure that this roadmap to a cure, that our research activities accounts for that. The goal is for every member of our community to ultimately benefit from our work. We must stay united. At the end of the day, it is very likely, I'll be honest, that some portions of our community will make it to the clinic sooner than others. We have quite a breadth of symptoms and functional consequences. But we want to represent everyone. And I can assure you, we are committed to aggressively pursuing an inclusive and multimodality approach to therapeutic development so that no one is left behind. And you will hear that today. Finally, we'll wrap up the day in the conference with closing remarks from Dr. Pang Kong Fox, the Foundation's new Scientific Engagement Director. And she's going to discuss the ways in which our families can continue to push the science forward, both by participating in the research and staying engaged and informed. During these talks, I'll warn you, you're probably going to feel in over your head and overwhelmed. I know I will. And you may have the inclination to tune it out, to walk out, maybe even fall asleep. But I urge you to stick with us. Take notes, write down your questions. If you don't understand a word that's used, ask what that means. We have to start to understand the science, the terminology that's used. We have to understand what we're up against, because we have to be active participants in solving it. I can assure you that no one has a greater sense of urgency than we do as families, and we have worked with that sense of urgency for the past 2 years. But I've also come to understand from the relationships we have developed with the extraordinary clinicians and researchers in this room and those in our network who could not be here with us today, that practicing medicine, doing this research, especially in the rare disease field, it's not a job for them, not even a profession. It is a way of life, one that is full of tireless dedication and compassion for our patients and families. And for that, we are so grateful. We're very fortunate to have you on our team. All of you at some point experienced receiving a cold email from one of us at the Foundation with a simple request to chat with us over Zoom so we could better understand your paper or your research or some manifestation of this disease. And for everyone who responded, yes, why not? I'll talk with these moms. Little did you know, we were roping you in. We're never letting you leave this community. As parent advocates and leaders of the Foundation, we are tirelessly and relentlessly trying to change the course of this disease. I hope in my daughter's lifetime. But I sincerely believe together as a community, we can, and we are going to do just that. So finally, before I formally introduce Dr. Henry Colcraft, our first speaker today, I want to take a moment to acknowledge all of our CAC-1A champions, and in particular those who are supposed to be with us here today, but instead are battling this disease in the hospital. We have no other choice but to ensure that what we are doing is everything that we can do for these warriors. We have to change the trajectory of their suffering. The stories of our CAC-1A champions are ones about never giving up. They are our reasons for being here. They've inspired us to never give up our hope. These kids have made us lose our minds, but they have made us find our souls. Because of these kids, our collective impact on this world is going to be greater and more valuable than anything we could have done on our own. And for that, I remain more energized and more hopeful than I've ever been. And I really, truly hope that you all do today. I hope you'll feel that same feeling I'm having. So let's get to it. Let's dig into the science. Let's learn this language together. Dr. Henry Colcraft, he's kicking off our sessions today. His international reputation in the field of ion channel research precedes him. We have the incredible fortune of having him on the Foundation's Scientific Advisory Board, and he has been a trusted and valuable advisor to the board and our work. We were incredibly thrilled to celebrate the announcement a few months ago that he and another one of our Scientific Advisory Board members, Dr. Elsa Rossignol, were awarded a 5-year, multi-million-dollar NIH grant for their project titled Towards Novel Therapies for CAC1A Neurological Disorders. Dr. Colcraft and Dr. Rossignol, who won that grant, they had never met until the foundation brought them together. That is the power of this work.